Pyoderma Gangrenosum in ulcerative colitis. Definition: Pyoderma gangrenosum is one of the most severe extraintestinal manifestations of ulcerative colitis and Crohn's disease. Lesions occur most frequently on the skin of the lower extremities and throat. Pyoderma gangrenosum surrounding an ileostoma is extremely rare.
In the spectrum of inflammatory bowel diseases, Crohn's disease and ulcerative colitis are the two heavyweights. They share symptoms but are very different. A key distinction: ulcerative colitis is localized.
It always starts in the rectum and then proceeds up the colon, can involve part of the colon or the entire colon.
In Crohn's disease, inflammation can occur anywhere along the digestive tract.
Crohn's disease can affect the small intestine. Then there's more issues with potentially malabsorption of nutrients.
There's also something in the way they move. Ulcerative colitis progresses in a continuous fashion, while Crohn's can skip around to other organs. It can create lesions and leave other tissue intact, leading to what doctors call a cobblestone pattern. Both these illnesses are autoimmune diseases, each characterized by chronic inflammation.
We don't know what causes that. The theories are that it could be a virus or a bacteria, maybe food antigens.
The inflammation is responsible for the associated pains, cramps, diarrhea, and bleeding. Other symptoms are weight loss and fatigue. Treatments for both are meant to control inflammation.
We have these newer medications which are given either by IV infusion or injection, and these are medicines that are developed as antibodies against some of the factors that really promote that inflammation. Generally, we can get somebody completely in remission and maintain them in remission.
Doctors believe patients with either form of bowel disease can lead a normal and productive life. For Lee Memorial Health System, I'm Amy Osher.
Application in medicine. An incidence of 3 to 10 cases per million years is estimated, and its presentation peaks between 20 and 50 years of age, being more frequent in women. Within the mucocutaneous extraintestinal manifestation, Pyoderma gangrenosum appears in 1 and 5% of patients with inflammatory bowel disease. Although in our settings the incidence has been somewhat lower,
we've shown you photos of some extreme medical conditions over the years, and today we have some of our most shocking yet. It's time for What Is This? What Happened? And Could It Happen to Me? So let's start with this picture. And as you all try to figure out what happened and could it happen to you, Dr. Batra, what did happen?
So this is actually a very zoomed in picture, and I think if you go back, you'll actually see the part of the normal skin on the breast. This is a condition that's really quite rare. It's called Pyoderma Gangrenosum, and it's a condition where when you have an injury to your skin, in this case, the picture is taken from a woman whose photo went viral. She was scratched by a cat. But what happens is all of these inflammatory cells rush to try and heal the injury, but they get stuck, and they're an overabundance of cells called neutrophils. And the way I always kind of think of this in my mind is like when there's an accident and all the bystanders are in the front lines, that the first responders can't get there and actually fix the problem. That's what's happening here. You actually have all of these inflammatory cells that are not meant to be there, crowding out the actual wound healing that's meant to occur. So anytime someone gets an injury, it just becomes this horrible, painful, non-healing ulcer. And this is actually really challenging to diagnose because you have to rule out all sorts of infectious causes and other possible reasons for this. You have to diagnose this on biopsy. It's much more common in people with other autoimmune conditions or certainly inflammatory bowel disease. And it's treated by very long courses of anti-inflammatories. So sometimes we were just talking about a couple of cases of mine in my clinic where it's taken months to years of long-term steroids or anti-inflammatories to actually make this get better, and does heal with pretty significant scarring as well.
So having the diagnosis of an autoimmune disease really helps you pinpoint that it's probably that, right?
Absolutely, but dermatologists always consider this sort of a diagnosis of exclusion because you can't just assume they have this horrible, painful ulcer. Just because of this, you're going to end up having to rule out other sources of infection. And pretty much it's a dual-edged sword. When you do the biopsy, sometimes the biopsy doesn't heal either.
Really?
So challenging,
Wow.
yeah.
Tough problem.
Pros and cons. Medical treatment of the bowel disorders with either corticosteroids or sulfasalazine has been claimed to benefit the skin condition. The etiology of Pyoderma Gangrenosum remains obscure. Various bacteria have been isolated from the lesion, but the initial pustules are frequently sterile. In the majority of patients, the skin condition pursued a relapsing and remitting course.
I've had Pyoderma Gangrenosum for 10 years and 1 month. I was treated for venous ulcers for 5 of those years. That involved triple layer bandaging, being told not to get the ulcers wet, and the surgeon wanting to remove my non-existent varicose veins.
Pyoderma gangrenosum is a rare and very painful skin condition that causes rapidly spreading ulcers on the skin. It's an autoimmune condition that's also associated with other autoimmune conditions such as rheumatoid arthritis.
I decided to do the stopgap trial in the hope of finding a cure or a standardised treatment. I don't want anyone else going through what I've been through. I want patients who have this condition to be diagnosed promptly and given the help we deserve.
Pyoderma gangrenosum can sometimes be treated with topical medications such as potent or superpotent topical corticosteroids, but usually systemic therapies are required. And the two most commonly used systemic treatments are oral prednisolone, which is a steroid medication, or cyclosporin, which is a drug that affects the immune system. And we wanted to compare these two most commonly used systemic therapies head to head in the stopgap trial. Doctors and patients can choose either of these treatments, safe in the knowledge that whichever they choose is likely to have similar benefit, and they can choose one that suits their own preferences or their other comorbidities that patients might have. Our big surprise really was that neither medication worked terribly well. After 6 months, less than half of the patients' ulcers had healed, and in those who did heal, 1 in 3 had a repeat attack. So this suggests that we urgently need new treatments for Pyoderma gangrenosum.
It's the pain that interferes with my daily life the most. It has driven me and my partner to the brink of insanity. It's the knowing that every time you reposition yourself, or if you need to get up, you're going to be in the most awful pain. I also get sudden nerve pain in my legs, and it's enough to make me yelp. It puts me off moving. On bad days I stay in bed, only getting up for comfort breaks and to take more medication.
The stopgap trial helped to raise awareness of this painful and debilitating condition, which is often misdiagnosed. These results are now being widely disseminated amongst many healthcare professionals, and patients themselves have been encouraged to take along the results of the study to share with their healthcare professionals. So for the first time, it means that patients and doctors can use this best quality evidence to make informed decisions about what's best for them.
I live in hope of getting better, being able to lose weight and getting back to work. I hope.
Issue a plea in Ecuador. Ecuador does not have its own date, one prevalence and or incidence of inflammatory bowel disease. Worldwide, the incidence of the pathology increased considerably even in low-risk treated countries. Ecuador is not the exception. Conclusion. Although no studies have been published on the effect of systemic mesalazine therapy of PG, a case of successfully treated PG with topical mesalazine cream was reported previously, and the authors suggested that leukocyte mobility and cytotoxics were suppressed by mesalazine in PG.